In this podcast episode, Thomas Seyfried, a leading cancer scientist, discusses his revolutionary perspective on the origin and treatment of cancer, emphasizing the role of mitochondria and metabolism. Seyfried challenges the mainstream genetic mutation theory of cancer and presents compelling evidence showing cancer as a mitochondrial metabolic disease. The discussion spans the impact of modern diets, lifestyle factors, metabolic therapies, including ketogenic diets and fasting, and how understanding bioenergetics can empower both prevention and management of cancer. Thomas Seyfried explains that cancer fundamentally arises from damage to mitochondria, the organelles responsible for producing energy in cells. Mitochondria are described as the powerhouse, but also an essential regulator of cell fate, controlling when cells divide and when they stop. Unlike the popular belief that cancer is primarily a genetic disease caused by DNA mutations, Seyfried highlights decades of research dating back to Otto Warburg in the early 20th century, which shows that damage to mitochondrial function disrupts normal energy metabolism, triggering cancerous growth. He points out that mitochondria have a tubular network structure sensitive to various environmental insults, and when injured, cells revert to ancient, inefficient energy production pathways, fermentation without oxygen, leading to uncontrolled cell growth characteristic of tumors. The mitochondria typically generate chemical energy, ATP, by burning glucose in the presence of oxygen through oxidative phosphorylation. Seyfried describes this process as comparable to an internal combustion engine, efficiently producing energy with carbon dioxide and water as waste. Carcinogens, chronic inflammation, viruses, and lifestyle factors cause oxidative stress and damage the mitochondrial membranes and proteins. Damaged mitochondria become inefficient, and cells compensate by switching to less efficient fermentation to survive. This metabolic shift results in the excessive production of waste products like lactic acid, even when oxygen is plentiful, a hallmark of cancer metabolism known as the Warburg effect. Importantly, cancer cells demonstrate abnormal mitochondrial structure under electron microscopy, often showing ghost mitochondria with impaired function. Cancer cells become heavily dependent on glucose and glutamine, two main fuels used in their altered metabolic state. Seyfried emphasizes that while normal cells can efficiently utilize ketones and fatty acids for energy via healthy mitochondria, cancerous cells cannot. Instead, they rely on glucose and glutamine fermentation to generate energy. This heightened demand makes cancer cells greedy and able to proliferate uncontrollably. Seyfried's research indicates that targeting these fuels simultaneously through metabolic therapy is critical to restricting tumor growth and survival. Seyfried introduces the glucose-ketone index, GKI, a biomarker tool developed to measure mitochondrial health and guide metabolic interventions. The GKI is calculated by dividing blood glucose levels by blood ketone levels, converted to compatible units. Lower GKI values indicate a metabolic state resembling that of Paleolithic humans, characterized by low blood sugar and elevated ketones, where mitochondria operate efficiently and chronic diseases including cancer are less likely. Conversely, high GKI values correlate with poor mitochondrial health and an increased risk of cancer and other chronic diseases. The GKI provides actionable insights for patients to monitor and adjust their metabolic state, mainly through dietary choices such as ketogenic or calorie-restricted diets, intermittent fasting, and lifestyle modifications. Seyfried recounts the case of a brain cancer patient whose glucose and ketone readings varied unpredictably, and using GKI helped clarify treatment goals. He stresses that living consistently in the green or prevention zones of the GKI chart makes it difficult to develop cancer or other metabolic diseases. Modern lifestyles laden with highly processed carbohydrates, sedentary behavior, chronic stress, poor sleep, and exposure to environmental toxins are damaging to mitochondrial function, resulting in metabolic dysfunction and elevated cancer risk. Seyfried contrasts this with wild animals such as wolves, which rarely develop cancer, versus domesticated dogs that suffer from obesity and cancer due to inactivity and processed diets. Stress hormones like corticosteroids elevate blood sugar and systemic inflammation, further impairing mitochondrial efficiency. Sleep is described as a restorative period, allowing mitochondria to recover and maintain energy homeostasis. Lack of quality sleep exacerbates metabolic damage, Exercise increases mitochondrial capacity and resilience, acting as a protective factor against chronic diseases, including cancer. Seyfried expresses frustration that the entrenched somatic mutation theory dominates oncology, causing neglect of the metabolic basis of cancer despite strong scientific evidence. Most oncologists do not recommend ketogenic diets or metabolic therapy, often due to lack of training or institutional backing, and sometimes actively discourage such approaches, fearing cachexia, severe wasting common in cancer patients. Seyfried clarifies that nutritional ketosis does not cause cachexia, distinguishing between therapeutic weight loss on ketogenic diets and pathological muscle wasting caused by tumors. The current standard of care often involves aggressive chemotherapy and radiation, which themselves induce oxidative stress and damage mitochondria, pushing patients into poorer metabolic states that can undermine treatment efficacy and increase tumor resistance. Seyfried advocates integrating metabolic therapy to enhance standard treatments, allowing lower drug doses and reducing toxicity while improving quality of life. Combining ketogenic or low-carbohydrate diets with chemotherapy and radiation can potentiate cancer cell death while protecting healthy cells, which enter a protective bunker mode under ketosis by slowing division and conserving energy. Cancer cells, lacking this evolutionary off-switch due to damaged mitochondria, remain vulnerable to therapeutic stress. Furthermore, ketogenic states help deprive tumors of glucose needed for DNA repair, making treatments more effective. Seyfried also points to other metabolic adjuncts, such as hyperbaric oxygen therapy, which selectively kills cancer cells through oxidative stress. Immune therapies may be more effective if patients are metabolically normalized first, reducing tumor inflammation and resistance. The discussion highlights the major role that chemical exposures like forever chemicals, e.g., non-stick cookware substances, microplastics, synthetic pesticides, and heavy metals play in chronic mitochondrial damage, increasing cancer incidence. Seyfried calls for policy changes addressing environmental toxins and food quality, especially in underserved food deserts where access to healthy, less processed foods is limited. Educational efforts must empower individuals with knowledge rather than impose authoritarian dietary restrictions. If Seyfried were in power, his first mandate would be wide-reaching education, focusing on mitochondrial health and preventing cancer by encouraging diets low in processed carbohydrates, regular physical activity, reduction of chronic stress, improved sleep, and avoidance of environmental toxins. He emphasizes personal responsibility and informed choice over government-imposed mandates and underscores that healthy food must be made more affordable and accessible to reduce disparities. Seyfried notes the need for scientists, clinicians, and the public to understand cancer as a systemic metabolic disorder and to adopt therapies that address its root cause rather than just symptoms. He also promotes patient empowerment through tools like continuous glucose and ketone monitoring and AI apps that help individuals track their metabolic health and make informed food choices. Intermittent fasting and ketogenic diets emerge as powerful tools to shift the body's metabolism away from glucose dependence toward ketones, reducing mitochondrial stress and improving mitochondrial function. Seyfried discusses practical strategies like easing into fasting by initially adopting a low-carbohydrate diet to minimize withdrawal symptoms from sugar dependence. His research shows that metabolic therapies can substantially prolong survival in aggressive cancers, exemplified by case studies of patients with glioblastoma and pancreatic cancer living far beyond typical prognoses while employing ketogenic diets alongside standard treatments. Metastasis, the spread of cancer to distant organs, is the major cause of mortality. Seyfried explains that metastatic cells arise from hybrid tumor and immune cells, macrophage tumor hybrids, that are particularly dependent on glutamine, making glutaminolysis a crucial therapeutic target. The press-pulse therapeutic strategy, which restrains glucose supply and then pulses glutamine-targeting drugs, shows promise for controlling metastatic disease and improving patient outcomes. Seyfried reflects on the resistance faced by radical scientific ideas throughout history, likening the dominant genetic theory of cancer today to outdated geocentric models once challenged by Copernicus and Galileo. Despite evidence validating mitochondrial dysfunction as the root cause, acceptance in cancer research and clinical practice remains slow. Seyfried pledges to continue advocating for metabolic oncology based on rigorous science and encourages patients and physicians to educate themselves and consider complementary metabolic approaches alongside established therapies. Throughout the podcast, Seyfried and the host emphasize the importance of informed patients advocating for themselves and forming supportive communities. They encourage cancer sufferers and their families to share experiences, explore metabolic tools like the GKI, and collaborate with open-minded healthcare providers. The episode concludes with an appeal for donations to private foundations supporting metabolic cancer research and clinical trials dedicated to transforming cancer care.